who can't be Those who can't be with us today can still view the program at a later time on our AARP Virginia YouTube channel. Please click Got It when it appears on your screen. If you are not familiar, AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering people to choose how they live as they age. AARP works to strengthen communities and advocates for what matters most, with a focus on health security, financial resilience, and social connection. Today's program focuses on Social Security and financial security. Before we begin, AARP Virginia wants to make sure you have the most current, up to date on Social Security. We are pleased to be joined today by Scott Musser, AARP's Senior Strategic Campaign Advisor. Scott, the floor is yours.
Thanks, Catherine. And hello and good afternoon to everybody. It's a lot of great fall activities I see out there. Love them all, the hiking to the scary movies to all the good food. But just want to do a little quick update for everybody. As you know, the federal government is in a shutdown, but just want to remind everybody, first and foremost, Social Security checks will continue to go out on time, and folks with Medicare should be able to continue accessing their health care. With that being said, we obviously are concerned about the challenges that some people might face when trying to get these services that they need. So we're continuing to urge Congress and the president to find a path forward to ensure that older Americans can continue accessing these services that are so vital to their well-being. And we also want to make sure that certain things like the expiration of the enhanced ACA, premium tax credits, Medicare telehealth, flexibilities and funding for the SHIP Medicare counselors are included in whatever the solution to get the government up and running again. But we're going to continue to push on that. But like I said, want to make sure people know. And the time being, Social Security checks are good. You should be able to get your health care. But you're going to hear a lot more of this stuff from the great folks on the call today, Jamie and Xavier. But just sort of remind people on it and just let you know, ARP is out there. We have and we continue to lobby Congress and the administration every day to make sure these important services and others that are so vital to our 50 plus membership are there and stood up and continuing for the future for our members and everyone. So with that, I will turn it back over to Catherine, and thanks for having me today.
Yes, thank you, Scott. Now, it's my pleasure to introduce our two guests and AARP's Social Security Program Manager, Jamie Lyle, and Xavier Vaughn, AARP's Medicare Program Advisor. Jamie Lyle is a dedicated professional with a background in psychology and social services. A graduate of Coppin State University and a holder of a master's in industrial organizational psychology, he has served as a technical expert at the Social Security Administration and currently works as a program manager at AARP, leading initiatives to strengthen Social Security. Xavier Vaughn, a program manager with Medicare programs at AARP, is passionate about service and giving back. He has a strong background in Medicare education, having developed and implemented new programs at the state and national levels. He is also an experienced public speaker, having presented at the American Public Health Association conference. Xavier was inspired to work in Medicare education by his grandmother, great grandmother, and other strong older adults in his life. He believes everyone deserves access to quality healthcare information and is committed to helping people understand their Medicare options. Please put all your questions for Jamie and Xavier in the Q&A window. Welcome, Jamie and Xavier.
Thank you for having me. I guess that's my cue to start sharing my screen. So give me one moment, everyone, to get up and running. Okay, and welcome everyone. Again, thank you for joining us for this special event with AARP Virginia. So at AARP, we're committed to helping you make informed decisions about your health and financial future. So today's session will give you the essential facts about Social Security and Medicare. When it comes to what you need to know, we're going to go over what they are, how they work, and what you need to know to get the most from your benefits. Before I get started, I want to just share a quick video on how AARP advocates on your behalf. Hello, I'm Jamie Lyell with AARP, and I'm sorry about that. How AARP is fighting for you every single day. From the State House to Capitol Hill, we're on the front lines protecting Social Security and Medicare. We're pushing back against proposals to cut benefits or raise the retirement age. We're making sure lawmakers understand that Social Security isn't just a program, it's a lifeline. And when it comes to Medicare, we're working to lower prescription drug costs and make sure you have the affordable, high quality care that you deserve. These aren't handouts, they're promises you've earned with every paycheck. And AARP is here to make sure those promises are kept. And if you'd like to stay informed or get involved, visit aarp.org/get involved and sign up for our free advocacy newsletter. One voice might get lost in the noise, but when a million of us speak up, Congress listens. So raise your voice and join AARP in making sure we're heard. Thanks for being here today and for standing up for older adults and future generations. Okay. Just a little bit about myself. I won't read the bullets on the screen, but I do love educating on Social Security at AARP because it does give me the chance to empower our members with the knowledge they need to navigate their benefits. Ensuring fairness and understanding in Social Security is such a crucial thing, and being part of AARP allows me to make a positive impact on the lives of those who have contributed so much to our society. And I will give Xavier the floor as well to introduce a little bit about himself.
Well, hello everyone. I hope you're having a great day and a happy Tuesday. My name is Xavier Vaughn. I'm a program manager of Medicare Education, part of the caregiving and health team at AARP. I've been here for about 2.5 years now, and I've been doing Medicare work for the last 8 years, 8 years. And so it's something that I think will impact us at every, you know, is something that will impact us all at one point in time or another, whether for ourselves, for our loved one, if we're in the caregiver role. And so it's just something that is really important that we all need to know. And I look forward to having a chat with you all today.
Thank you, Xavier. Well, so on to our program. So when I think about Social Security, I do make some sport references. So I like to imagine Social Security as your financial defense. So just like LeBron blocking shots, it protects you from unexpected financial hits in retirement. And for today's agenda that we created, and helping you understand your Social Security payments and Medicare, we'll make sure to go over the Social Security basics, Medicare 101, enrollment periods and coverage options, how Social Security affects Medicare premiums, and we will, at the end of this presentation, have time for live Q&A to answer your questions. So the basics of Social Security. Now, Social Security was created in the 1935 in the aftermath of the 1929 stock market crash and the Great Depression. It is based on the concept of social insurance, which means that all workers contribute to the central trust fund that's managed by the government. Almost everyone contributes to the Social Security Trust Fund. Those Social Security taxes are called FICA, F-I-C-A, which stands for the Federal Insurance Contributions Act. It's a tax paid by employees and employers that fund Social Security and Medicare. Current tax rate for Social Security is 6.2% for the employer and 6.2% for the employee, for a total of 12.4%. To be eligible to collect retirement payments, a worker must have worked for at least 10 years or have earned 40 credits and paid Social Security taxes. The Social Security Trust Fund is used to provide payments to individuals who are retired, disabled, or are a survivor of a deceased worker. Social Security was always intended to be a safety net to provide some income. It was never intended to be the only source of income, but despite this, many recipients are using it for most or all of their income. And I want to get into who can collect on your record. Now, when you start receiving Social Security retirement payments, some members of your family also may qualify to receive payments on your record, with certain requirements for children, spouses, ex-spouses, and survivors can receive Social Security payments on your record. And I'll dive into each group right now. So the children of retired, deceased, and disabled workers can, in many cases, collect Social Security payments on a parent's earnings record. Social Security incorporates children into its payment structure to help retirees with younger children provide for their families and as a form of insurance when a parent dies or can't work because of a disability. Within your family, each qualified child may receive a monthly payment up to half of your full retirement age payment. To be eligible, your child must meet certain qualifications for your children to receive payments. They must be unmarried and under age 18, or 18 and 19 years old and a full-time student up to grade 12, or 18 or older and disabled prior to age 22. However, there is a limit to the amount Social Security can pay your family members, children, and others. The total depends on your payment amount and the number of family members who also qualify on your record. That total does vary, but generally that total amount for your family you can receive is about somewhere between 150 to 180% of your full retirement age payment. Now, if you don't have enough Social Security credits to get payments on your own work record, or your own retirement payment is too small, you may be eligible to receive payments as a spouse. It is important to note that if both you and your spouse are eligible for Social Security payments on your own records, Social Security will pay you whichever amount is higher, but not both. You cannot double dip. Eligible spouses can generally receive 50% of the eligible worker's full retirement age payment amount. And even if the working spouse collects early, the spousal payment will still be a portion of the worker's full retirement age payment. And if you are still married, you only can file on your spouse for a spousal payment once the working spouse has filed for their own payment. You must be married for at least 1 year and 62 years of age or older, or you can claim at any age if you're caring for a child under 16 or a child with a disability who is entitled to payments on your spouse's record. Can't talk spouse without talking ex-spouse. And ex-spouses can receive payments on their former spouse's record if they were married for at least 10 years. Ex-spouses may file at any time beginning at age 62 and do not need to notify their ex-spouse that they have filed. And I do get this question a lot. Social Security will not notify your ex-spouse that you have filed either. Eligible ex-spouses can receive generally 50% of the eligible worker's full retirement age payment amount. Even if the former spouse collects early, the ex-spouse's payment will still be a portion of the former spouse's full retirement age payment. Ex-spouse's payments do not affect the ex-spouse's payment amount, nor does the payment amount of a new spouse should they have remarried. And you're eligible to receive payments on an ex-spouse's record if your ex-spouse receives his or her own Social Security payment or is at least age 62 and you have been divorced for 2 years. You are at least 62 and you have not remarried. It is important to note that if both of you and your ex-spouse are eligible for Social Security payments on your own records, Social Security again will pay you whichever amount is higher, but not both. A little bit different than spousal payments is survivor payments. In the event of a spouse's death, a survivor can collect up to 100% of the payment that the deceased was receiving or would have received in the future. I get that question a lot as well. So just want to highlight would have received in the future. So if they do pass, unfortunately, before claiming, that still is in the equation of the formula to what you will receive. So this would include any delayed retirement credits the deceased has earned. However, it will also include a reduction if the deceased spouse claims early. Survivor payments can be claimed as early as age 60, 50 if disabled, but they will be reduced. They can also be claimed only at any age if the survivor is caring for an entitled child. So any age if the child meets those requirements. Dependent parents also may be eligible to collect. if the deceased parents can show that they relied on that child for at least half of that support. Ex-spouses may also be eligible if the former spouse was at least 60 or 50 to 59 if disabled. They were married for at least 10 years and have not remarried unless they remarried after 60. For survivor payments, if you remarry after 60, that will not affect your eligibility. And survivor payments are only reduced based on when the survivor payment itself is claimed. In many situations, a surviving spouse can continue collecting on their own record to allow the survivor payment to grow until they reach full retirement age. That is a claiming strategy available to survivors. The survivor is still subject to the earnings limit if they haven't yet reached their full retirement age and continue to work. So remarrying, if you remarry before the age of 60, 50 if disabled, then you can't receive survivor payments while you are married. Now, if you remarry after 60, 50 if disabled, then you can continue to qualify for payments on your deceased spouse record. However, if your current or new spouse is a Social Security beneficiary, you may want to apply for a spousal payment on his or her record. If that amount is more than your widow's or widower's payment, you will receive a combination of payments that equal a higher amount. And we're going to skip this quiz and we're going to move right past that one for the sake of time and the information that we have to cover. So when can you claim your retirement payment? Now you can choose to receive your payment as early as age 62, but your monthly payment amount will be reduced by as much as 30%. And this reduction is permanent. This includes any survivor payments your family may be eligible for. So it's important to consider how this decision will impact anyone who might collect on your record as well. You can receive your full retirement amount at your normal or full retirement age, which is somewhere between 66 and 67. And I'll show a chart in the next slide to kind of show this for my visual learners similar to myself. And it is depending on your birth year. You get 100% of your payment if you claim at your full retirement age. And then you also have the option, if you can wait, that is, you can delay your payment beyond full retirement age. That is, this increases your payment amount by 8% a year up to age 70. So it can really pay to wait. And here's the chart. So full retirement age, you'll see your year of birth on the left side. And on the right side, you'll see what full retirement age will fall with your birth year. Anyone born in 1960 or later, your full retirement age is 67. And I like to provide this chart to just show how claiming age can really affect your monthly payment amount. So in this example, we will assume that this individual claimed at their full retirement age, which for them, it was 66 years old. You see this here in the gray column. Their full payment amount is $1,900 per month. Now, if this person had decided to collect payments at age 62, that monthly payment amount would have been $1,425. But if they waited until age 70, their monthly payment would be over $2,508. So deciding when to claim is a personal decision that only you can make. You will need to consider factors such as your health, savings, expenses, and how the decision can impact your family. Remember, though, the impact of your claiming aid isn't just on your own retirement. It also affects the survivor payments your family members might receive if they outlive you. And I like to just provide these scenarios to fictional characters, Tia and Andre. So if this is your name, I apologize. Fictional characters. So in both scenarios, it highlights the trade-offs between early access to funds and the long-term financial impact of the decision. So we'll have two neighbors here, Tia and Andre, both eligible for Social Security. Tia decided to start her benefits at age 62, earliest possible age, but she does receive reduced payments. But that does allow her to enjoy that immediate income. She uses it to travel, pursue hobbies. But however, by the time she reaches age 78, she realizes that her lifetime benefits are significantly less than she had waited. If we have Andre, on the other hand, he waited until age 70 to start his benefits. He receives larger payments due to those delayed retirement credits that we recently discussed. Although he must use his savings in the interim, such as his 401k or IRA, by age 78, he has received higher monthly payments and his total benefits have surpassed Tia's despite starting later. Again, that right choice depends on individual circumstances, such as health, life expectancy, and financial needs. Now, applying for Social Security, there are several ways you can apply for Social Security. With any of these options, you can apply up to 4 months prior to when you want your payments to begin. You can apply online by making a My Social Security account at login.gov. You can go to ssa.gov directly. You can also call the 1-800 number Monday through Friday, 8 a.m. to 7 p.m. local time. They also have an option if you're deaf or hard of hearing as well. They have that TTY number that you see there on the screen. Or you can reach out to your closest Social Security field office. And you can use that ssa.gov/locator to find your local field office. Wait times currently are averaging around a month, unfortunately. So definitely make an appointment if you would like to go in. One of the main reasons to go into the field office is if you have a very specific situation that has a lot of intricate parts to it, that you need real answers from a live person at that time. And you don't want to wait months between calls. Now, the exact amount of your monthly payment is based on what you've earned during your lifetime. The Social Security Administration will look at your highest 35 years of earnings. So if you would like to estimate your payment amount, there are 4 ways you can do that. Again, that useful My Social Security account. You can go to ssa.gov online to print and complete Form 7004 and mail it to the Social Security Administration. You can call the 1-800 number. And if you do not have a My Social Security account, for those age 60 and plus, you will receive a Social Security statement in the mail, and it comes usually about 3 months before your birthday each year. Now, one thing to keep in mind, moving into the next part, is when you're estimating the amount you receive from Social Security, you want to consider the cost of living adjustment or COLA. Each year, that amount you receive from Social Security will be adjusted to account for inflation. So far for 2025, we're still waiting for 2026. So for 2025, the cost of living adjustment COLA is 2.5%, and that works out to be about $50 a month and a raise for the average Social Security retirement payment. Additionally, it's important to consider that currently there is a wage cap on tax earnings. So in 2025, that means that workers only pay FICA taxes on the first $176,100 of their income. If you have more than one job, your employers are required to withhold FICA taxes. So you'll have to request a refund of any taxes paid on income above this wage cap when you file your taxes. And a big one, collecting Social Security while working. Before you claim your Social Security payments, before your full retirement age, you should know that if you claim early and continue to work, you may be subject to what's known as the Social Security's earnings limit. In this scenario, your payments will be reduced by $1 for every $2 earned above the earnings limit. This increases in the months prior to reaching your full retirement age. So your payments are reduced by $1 for every $3 you earn above that limit. And note that these limits adjust with inflation yearly. So in 2025, Social Security earnings limit is 23,400 for people who have not reached their full retirement age, and 62,160 for people who will reach their full retirement age during the year. However, if you claim Social Security retirement payment before your full retirement age and keep working, some of the payment reduction will be returned to you in a form of a higher monthly payment as a credit after you reach your full retirement age. Once you reach your full retirement age, the earning limit no longer applies. You can work and you won't have to worry about these reductions. Now for the Social Security Fairness Act, the 2025 Social Security Fairness Act did repeal 2 provisions: the windfall elimination provision, also known as WEP, and the government pension offset, also known as GPO. These previous provisions reduced Social Security payments for individuals who also received a pension from jobs not covered by Social Security, such as teachers, firefighters, and police officers. This new law impacts approximately 3 million current retirees, their spouses, ex-spouses, and surviving spouses. So if you've worked in a public sector job and received a pension, you are likely affected by this change. This law is retroactive to January 1st of 2024. And SSA has stated that they have completed processing the benefit adjustments under the Fairness Act. It is important to update your information on that My Social Security account. Make sure everything is up to date. So again, make sure you set up a My SSA account at login.gov. And a topic kind of popular right now, the future of Social Security. Now, right now, Social Security is in good financial shape overall. However, according to the annual report released by the trustees in June 2025, the two Social Security trust funds that act as reserves for the program will be depleted around 2034. Our population has changed. People are working and living longer. Considering that in 1950 there were approximately 16 workers contributing to FICA per person receiving payments. But that in 2035, there will only be about 2.3 workers contributing to FICA per person receiving payments. And that's a big difference. And is why we need to act now to secure Social Security. So what this ultimately means is that after the year of 2034, Social Security will only be able to pay about 81% of payments recipients are scheduled to receive. Policymakers will have to act to address the future payment shortfalls, and the longer they wait, the harder those choices become. Now, AARP is a nonprofit, nonpartisan organization. We have developed these guiding principles to help fight to protect Social Security in alignment with our mission. Ultimately, AARP does believe that any proposal should finance Social Security for the long term. Social Security should continue to provide a stable foundation for retirement income, protect those most in need, continue to reward work, and ensure that workers' payments are clearly defined and cannot be outlived and are protected against inflation. And any proposal should make improvements to address the economic and demographic changes. And any changes to Social Security should protect current recipients and those near retirement and be made gradually and fairly. And Congress does have several options to address the program's long-term physical challenges. For example, here are 5 potential solutions that are here on the screen that will make sure Social Security can pay out 100% of earned payments for everyone who is eligible for generations to come. You can learn more about these options with these free resources. You see the Council for Economic Education and also the American Academy of Actuaries. And moving forward, we will now go into Medicare. Let me make sure I give Xavier control. There we go.
Okay. Thank you, Jamie.
You're welcome.
So as we are starting Medicare, we are in open enrollment season. So this is the one time of year where people really think about their Medicare. If you don't think about it all year long about what you're enrolled in and what you have access to, you definitely do think about that during this time. So what is Medicare? Medicare is a federal health insurance program for people who are age 65 and up. And if you are already collecting your Social Security, then you are automatically enrolled into Medicare at the age of 65. And this is just your reminder, 65 is no longer the retirement age. So your Medicare age and your retirement for Social Security age are 2 different numbers now. And so that's where some people get confused. So please do not get confused on that. If you're under the age of 65 and you are currently collecting disability or SSDI, your 25th month, you'll be automatically enrolled into Medicare. So if you're 65 and already collecting your Social Security, or if you're on disability, you're automatically enrolled. If you are 65 and you're not collecting your Social Security, then you are not automatically enrolled, and you actively have to enroll into Medicare. If you have end-stage renal disease, you qualify for Medicare. If you do in-house dialysis, you have 1 month you have to wait, or if you're in a facility at a dialysis clinic, then you have 3 months. Also, if you have ALS, you also qualify. So ALS, end-stage renal disease, 65 and not collecting your Social Security, then that you have to actively enroll into Medicare. And for time's sake, we'll skip the quiz as well. What does Medicare not cover? People are often surprised to hear that Medicare does not cover long-term care. This is your nursing home coverage and hearing, dental, and vision. There are a couple of exceptions. For example, if you're diabetic, you may have a little vision services that is covered under Medicare. Also, foreign travel is not covered. There are a few exceptions for that. For example, if you're driving to Alaska, there's no way to get to Alaska without going into Canada, right? So if you're on your way there or on your way back, you would have coverage. Also, if you are near the border and the closest hospital is in the other country, then you would also qualify. Then it would also cover that. So when do I enroll into Medicare? As I mentioned earlier, if you are receiving Social Security, you're at 65, you're automatically enrolled into Medicare. And even if you're not, you still have the same 7-month period. Your period is 3 months before your birth month, and 3 months after your birth month. And the same philosophy goes towards if you are receiving Medicare due to a disability. So think of your 25th month enrolled in SSDI as your birth month. The one caveat to that would be if you are born on the first of the month, then your birth month is actually the month prior. I like to use my Uncle Charlie. My Uncle Charlie, he was born on June 1st, right? So June is not his birth month. May is his birth month when it comes to Medicare. So that moves up the process for him a whole month. And that can really throw someone behind if they are, um, you know, late in enrolling into Medicare and they're thinking they have one more month. No, their month is over. Their 7-month period is over. And it is really important to enroll into Medicare when you're first eligible. That does not include if you are still working and having coverage through yourself or through a spouse. But if you do not enroll into Medicare when you're first eligible, then you may have to pay a higher Part B and Part D premium. And there are special enrollment periods for people who are transitioning from working into the Medicare landscape. So your initial enrollment, which we talked about earlier, is that 7-month period that you have to enroll into Medicare. And that's really important to get right. Your responsibility for Medicare. None of this that's on the screen should look foreign to you. You have your monthly premiums, your deductibles, your co-insurance, and co-payments. Those are the same responsibilities that you have with an employer-sponsored healthcare. So there are a couple of different ways one can get their Medicare. The first being original Medicare, which is Part A, B, and you can add a D plan and also a Medigap or supplemental plan to have the original Medicare. Or you can bundle A, B, and most of the time D into one comprehensive plan, and that's your Medicare Advantage, or also known as your Part C. So Part A, and just as Jamie was going through his part of the presentation and was using 2025 information, I will also be using 2025 information. 2026 information is not yet available for Medicare. With that being said, we do have some estimates that I can mention throughout the presentation. So typically there is no premium for Part A. Also, as Jamie mentioned, he talked about those 40 work credits and that 10 years to take to obtain. That is why we do not have to pay for a premium Part A, is because you get those through those 40 work credits. With that being said, like Jamie said, it takes about 10 years. I'm 31. I've had, I think, my full 10, my 40 work credits since I was about 27. So it's something that you get fairly early in your career if you're able to work that long. If you do not qualify for it on your own, then you can draw off from a spouse. And if you have a child, they could potentially draw off from you as well. And it used to be, and we're seeing this less now, but there used to be some careers that didn't pay into Social Security, and that's where some of the issues would have. So teachers are a really great example who didn't pay into Social Security, and so when it came time for Medicare, they didn't qualify for premium free Part A. So the deductible for this year is $1,676 for day 1 through 60 in inpatient care. And the deductible can be applied again for additional hospitalizations after 60 days. So for example, I'm out on New Year's Eve, New Year, and I'm on my way home on after midnight is now New Year's Day. I go to the hospital on January 1st. I would have to have the deductible of the almost $1,700. I have to go. I get to go home a couple of days later. Now it's February 15th. I have to go back to the hospital. I am still within that deductible of that 60 days, right? So I wouldn't have to pay more money on top of that. That $1,700 would cover that cost. Now it's June. And I have to go back to the hospital. I would then have to pay that cost again. So Part B, which is your medical. And how I like to remember that Part A is for hospital and Part B is for medical. If you put A and B in alphabetical order, they coincide to their parts. And so Part A also covers in-home care, a room if you're in the hospital, hospice, that's all under Part A. And it's also your skilled nursing facility. So if you have to go to a rehab, you get to learn how to walk or something right after an accident, then that also comes out of Part A. Part B, the standard premium for this year is $185. I think for next year, the estimated Part B premium is slightly over, I think, $200. And so those estimates are pretty spot on what they are every year. If you have an income of 106,000 for an individual or 212 for a couple, then you will have to pay a higher premium for your Part B. With that being said, if as an individual who makes 106,000, you're not going to pay the same amount as someone who makes a $500,000. There is a sliding scale of what people would pay. And the annual deductible is $257, and co-insurance is 20% for most services. So for Part B, which is your medical, this is going to be your primary, your specialists are all going to come underneath Part B. This is also going to be preventative services, so cancer screening, STI screenings, smoking cessation, obesity counseling, all that falls, vaccines, all fall under Part B. And also your durable medical equipment, so your hospital beds, your wheelchairs, that is all under Part B. And so if you were to go to your primary care, you would be responsible for 20% of that service. Part D coverage, this is fairly new to the Medicare world. Medicare, as Social Security is in their 90th birthday, so Medicare is in his 60th birthday. And I know I saw in the chat that someone is from Missouri, just like me. And so a little fun fact about Medicare, Medicare was actually signed into law in Missouri, in Independence, Missouri, which is right outside of Kansas City. And Harry S. Truman and his wife, which is Harry S. Truman is the only president from Missouri, were the first people to receive a Medicare card. But Part D is fairly new. It is only about 20 years old. It came into effect in 2006, and this helped. And how you remember Part D? D is for drug. Help cover the cost of your prescription drugs that you pick up at the pharmacies. Unlike Part A and Part B, which is known as original Medicare, which is regulated and administered at the federal level, this Part D is administered through a private insurance company. So this is going to be your Humana, your Aetna, United Healthcare. Each year in September, you should receive an annual notice of change, and this will let you know of any changes to your current plan for the upcoming plan year. So this will include if any medication will not be covered, or if the cost of the plan is changing. And it's really important that you look at the formulary or the list of the medications that are covered each and every year to ensure that your medication is covered. So Medicare and the Inflation Reduction Act, or the IRA, there's been a lot of improvements to Medicare due to the Inflation Reduction Act. First being that insulin is now available at $35 per month. And this is not stating that every single insurance company will cover every single insulin. So it's still important to make sure that the insulin that you are on is covered by your plan. And if that insulin is not covered by your plan, then have a talk with your provider to see if you can switch to a different insulin. Access to recommended adult vaccine without cost sharing. There was also the expansion of low income subsidy, which is a program administered through the Social Security Administration to help cover some of the costs associated with your prescription drugs. And this expanded the level to 150% of the federal poverty level starting in 2024. And you can see it, I skipped one of the bullets because I think this is the most important one. So many people who are on Medicare or know someone who's on Medicare or just about to become that age. They have heard of the dreaded donut hole, and they don't want to be in the donut hole because your medication is so expensive during that time. Well, the donut hole is now closed. And instead of having this high out-of-pocket max when it comes to your prescription drugs, the yearly cap for this year is $2,000. Next year, it does go up slightly to $2,100. And not only is the cap at 2,000 or 2,100 for next year, you can now spread that cost throughout the entire calendar year. So if you're on a medication that costs a lot of money, where you would maybe reach your cap of $2,000 within the first couple of months of the year, there is now a formula in place that can spread out the cost throughout the entire calendar year. Now, they will not automatically do that for you. That is something that you have to actively enroll in, but the option is available to beneficiaries. So Part C or Medicare Advantage plans, this is what you see all the commercials on TV, right? This is where we see Jimmy, JJ Walker from Good Times, Dynamite. This is where we're going to see him on the commercials kind of highlighting. In this day and age, we love a good bundle deal. You can now bundle your streaming services. Or my example I always used to use is your phone, internet, cable into one comprehensive plan, right? And that is exactly what Part C or Medicare Advantage does. It bundles your Part A, your Part B, and most of the time your Part D into one comprehensive plan. And the thing about the Medicare Advantage plans, they're going to be your HMOs and your PPOs. And even if you're not exactly sure what an HMO and a PPO is, those are the type of plans you sign up through your employer, right? So they're going to seem very familiar to you, and they may seem comfortable to you. But with HMOs and PPOs, you do have to deal with in and out of network, and that is the important thing to remember here. And in order to have a Medicare Advantage plan, you still have to sign up for original Medicare, but you can then get your services through the Medicare Advantage plan. And they have to cover everything that original Medicare covers. And just like with Part D as a drug, Part C is also offered through private insurance companies. Enrolling into a Medicare Advantage plan could limit your ability to purchase a Medigap in the future. So here are some of the penalties that we were talking about. With Part A, if you do not sign up when you're first eligible, then you have to pay a 10% increase for the monthly premium for twice the number of years you do not sign up. So if you go 1 year without signing up, then you would have to pay that for 2 years. And it's really important to note for Part A and Part B, when I say a year, I mean a year. So it's every 12 months. So if you go 15 months, that's still a year. 23 months, that's still a year. It's not until you reach that 24th month that it will bump up, to the 2 years. Part B, whereas Part A is a limited time, Part B and D will stick with you for a lifetime. So Part B is a 10% increase for a monthly premium for each 12 months you do not sign up. And that penalty will stick with you as long as you have Part B coverage. Next is Part D. So for every month you go uncovered. And remember, Part D is technically optional. So even if you are new to Medicare, you're healthy, you do not have any medications you take, it is still highly encouraged to sign up for a Part D plan. Okay, when the time comes for you to get, when you need some medication, then you're going to have to pay a penalty. And unlike, and for like for Part A and B, which is for every year, Part D is for every month you go uncovered. You have to pay a 1% of the natural base beneficiary premium. And for this year, that is $36.78 for the full time that you go uncovered. The example I love to use about this, when I was counseling people one-on-one for their Medicare, I think this was back in 2018. And in Missouri that year, the cheapest plan we had was $15. It was a great, very comprehensive plan. We enrolled almost every person that we saw in that plan. Okay? The coverage was so good. With that being said, I was counseling someone, and this person never signed up for a Part D plan. So from 2006 to 2018, that is 144 months that this person went uncovered. So you can see where her penalty would have been more expensive than what the actual plan that I would have enrolled her into was. So you can see where it is really important to stay up to date and make sure that you're in the know when it comes to enrolling into your Medicare, where you can avoid these penalties. The only way, two ways you can get out of these penalties. One, if you're on Medicare due to a disability, once you reach 65, they treat that as a clean slate. The second way to get rid of it is if you qualify for an assistance program. So if you qualify for like the low income subsidy that we mentioned earlier, or the Medicare savings program, or a Medicaid, then your penalties will be wiped as well. Open enrollment. Open enrollment starts next week. It is October 15th through December 7th. It's the same exact time every single year. Medicare Advantage open enrollment is January 1st through March 31st. During this time, if you are someone who is enrolled into a Medicare Advantage plan and you need to make a change, you can do so during this time. You can also make a change to your Medicare Advantage plan during open enrollment of October 15th through December 7th. And during the Medicare Advantage open enrollment, your coverage will take effect the first of the following month. As I mentioned earlier, you will receive an annual notice of change in September, roughly, and there will tell you all the, if your medications is changing, if the price is going up, and all those things that you need to know. Every year, you get that really thick Medicare and You book in the mail, which can be, I know, very overwhelming because it is a pretty thick book. But do not fret, because on the back of that book is a 1-800 number, and that 1-800 number is to your state health insurance assistance program or your SHIP, and they will provide free and unbiased Medicare counseling, and they can actively enroll you into our Medicare when you're first eligible, but they can also assist you during open enrollment in your Medicare Advantage selections and your Part D selections. They're not going to push you into a plan. They're just there to guide you and help you and then enroll you into the plan that you select yourself. So, special enrollment, those can be triggered by certain events such as moving or losing coverage. If you're also moving into a nursing home, that will also trigger open enrollment or a special enrollment, I'm sorry. And then transitioning from employers sponsored health coverage to Medicare will also trigger a special enrollment. Medicaid and other assistance programs. So Medicaid is one way that a person can get help with long-term care or nursing home coverage. There are strict eligibility criteria for the long-term care services, and all states must provide certified facilities. Now, assets and things can vary from state to state, especially in states that have expanded. There's also a Medicare savings program. Medicare savings program is kind of the in between a full-blown Medicaid and low-income subsidies. It helps you with whereas low-income subsidies only assist with Part D plans, Medicare savings will help pay for Part D and also Part B coverage as well. And I see that in the chat that we do have the 1-800 number for VICAP, which is the SHIP in Virginia. And if you go to that link also below that, shiphelp.org, if you're in another state, I know there's several people here in another state, that you can get your 1-800 number from there. VICAP is great. I have worked with them multiple times. Great people. Let's see. Sorry, the train just lagging a little bit, and now we'll take it pass it back to Jamie.
Okay, looks like we have some Q&A questions from our audience. Okay. One of the questions is for, I think this is for Jamie. I turned 70 in January, have been getting survivor's benefits. Do I need to apply now to receive my benefits under my Social Security benefits? Am I allowed to continue current survivor benefits if it turns out to be higher than my benefits under my Social Security number?
Give me that question again,
Okay,
Catherine.
sorry
Sorry.
about that. I turned 70 in January, have been getting survivor benefits. Do I need to apply now to receive my benefits under my Social Security benefits? Or am I allowed to continue current survivor benefits if it turns out to be higher than my benefits under their number? That's probably what they're saying.
Yeah, so you definitely have the option with survivor benefits, specifically, just if anybody is wondering about survivor and spouse, sometimes it gets confused. But you do have this strategy, vice versa, to claim that survivor benefit, um, or your own benefit, and allow that other benefit to grow. Keep in mind, you can claim as early as 4 months before you want your benefits to start. Did she mention her name? Not her name, her age in that question, Catherine, by chance?
They say they turned 70 in January.
Okay, so if you turn 70 in January, 4 months before that, you can file. And did she say? I wish I could have saw that like
That's
actual
okay.
question, but did she state if she already is receiving either benefit?
She is getting survivor's benefits now. Mhm.
Yep. So you can keep getting those survivor benefits. And when you turn 70, then you can apply for your own, and then Social Security will look and see which one is higher, and that'll be what you would receive.
And this looks like this is another question that piggybacks on that one. Do you need to apply in person for survivor's benefits?
That is a great question. So you shouldn't have to apply in person for survivor benefits unless you're unfortunately flagged to come in to identify yourself with the new identification process that Social Security has put in place. But outside of that, you can do it online with your My SSA account.
Okay. Let's see. I think you all have agreed to stay a little bit longer because it looks like there's a lot of questions. I am concerned about delaying claiming, which is what I am doing now. So they're delaying due to all the chatter about cutting benefits. Do I know there's no way to know, but still hopeful? Okay, I'm trying to get this. That those will have future cuts to benefits. Um,
And remind me, is that
sure.
question to me, Catherine?
I'm not sure about that one. Let me try to read it again. I
Okay.
am concerned about delaying claiming their benefits due to all of the chatter about cutting benefits. There's no way to know, but still hopeful that those will not have future cuts in benefits. I don't.
I think that might be a
Yes,
statement more than a question.
yeah, I'm sorry about that. If I claim before the full retirement age at 63 and work making up to the annual limit, 22,320, can I also receive spousal benefits, 50% of spouses' full retirement benefits?
Well, that's a good question. So if you claim before your full retirement age and you're working, keep in mind if you're claiming at 63, that can affect how much you will receive. You can receive possibly get a reduction in your benefits. So it will be possibly 40%, but with a reduction. So keep that in mind when you're claiming those spousal benefits, when you're figuring out your strategy for when you want to claim.
Okay. This looks like it's a question for Xavier. I have an autoimmune disease. If I want to change my Medicare supplement plan F to another provider, will the new provider need to underwrite me? I would never qualify for a new provider with an autoimmune condition.
Yeah, so for the most part, and there are state-specific rules. So unlike original Medicare Part C, Part D, which is all regulated at the federal level, Medicaps, or also referred to as supplements, are regulated at the state level. So there are state-specific rules that I just will not know about. But most of the time, if you want to switch to a different plan, you would have to go through underwriting. The one caveat would be there are some state rules that help people to change sometime within the same letter. And so it could potentially, in your state, there could be a rule to where during your anniversary period or during your time you signed up for your supplement to begin with, that you could be able to go to a different plan and you wouldn't have to go through the underwriting. But like I said, they all differ from state to state. And so that would be a great reason to contact your SHIP, your state health insurance assistance program, so they can get you that state specific information.
Okay. This looks like it's another question for Xavier. How are Medicare insurance, both Part B and Medigap plans billed? Social Security or separately?
Yes. So your Part B is Social Security is where you sign up for Medicare, right? But they don't administer like the day-to-day stuff when it comes to Medicare. That's going to be through CMS, the Center for Medicare and Medicaid. And so that they will handle and will handle that part, that where Medicare is housed, right? And then for your supplement, that would be that private insurance company that will do some coordination of benefits with Medicare to make sure that that the bills are billed correctly and for you can pay the appropriate amount.
Okay. Um, think you've answered that one. My husband was born in 1950, retired at age 67, and was disabled at 68. Are there any options to collect disability?
Let me take myself off of mute.
Okay.
So okay, so so you can't receive SSDI if you're already receiving full retirement benefits. Fortunately, Social Security does allow someone to collect both SSDI and retirement benefits on the same earnings record. Once a person does reach that full retirement age and starts retirement benefits, Social Security disability is no longer available. I wanted to just state that. I'm looking at the question now. I was able to find it for the numbers. Yeah, that basically, unfortunately, yeah, that does answer the question. I was seeing if there's more to add to that, but yeah, once you start receiving that retirement and you're at your full retirement age, Social Security retirement is what's going to be what you're eligible for. You wouldn't be able to also collect disability.
Okay. Here's another question. I think Xavier, if readmitted to the hospital for the same reason a second time, 4 days after first discharge, do you have to pay the 1375 out of pocket cost once or twice?
So you're still within those 60 days, right? So you would be okay. You would only have to pay it once.
Okay. Do y'all have time for another question?
I have
Yes.
time. Yep.
Okay. Um,
Catherine, you can go until about close to 3:15.
okay. Hold on one moment. I know some other questions have come in. Okay. Are there any risk or issues to engage in a Medicare insurance broker if they are truly independent and represent multiple insurance companies?
Yeah, so I think the one thing to keep in mind is a kind of like that last part of that question, making sure that they cover multiple insurance companies, right? Because they may show you a good plan, but just because it's a good plan doesn't mean it's necessarily the best plan for you and your needs are. And so making sure that they offer multiple plans and also just reading reviews, see, or going to someone that's one of your friends or family members has gone to would really help to make sure that you're getting the best credible information from a person who is trustworthy.
Okay. Um, let's see. Can you review the potential benefits for a divorced 88-year-old woman who was married for more than 10 years and whose ex-husband is deceased? How would she apply for benefits? The deceased ex-husband or the higher wage earner?
And read that question to me again. I want to make sure
Okay,
I'm following that scenario
right.
correctly.
I'm sorry.
No, that's fine.
Can you review the potential benefits for a divorced 88-year-old woman who was married for more than 10 years? The ex-husband is deceased. How would she apply for benefits? The deceased ex-husband who was the higher wage earner. I guess that was a statement.
Yeah. So if you're looking to review the potential benefits for the 88-year-old woman, married for at least 10 years. Okay, so she met that part for eligibility. Ex-husband is deceased, so that'll be survivor benefits. Now, how will she apply for those benefits? She can go online to My SSA account. If she's not tech savvy, then she can also set up an appointment with the local field office, or she can also just call the 1-800 number. Wait times are kind of up there for the 1-800 number. So the quickest would possibly be online. Second would be to make an appointment, and probably will be a month or two out. Um, and how would she apply? Yep, answered that. And then the deceased ex-husband was a higher wage earner. So what she would do, she would want to have both of those individuals' social security numbers, the divorce decree, any information that social security is requiring of her. And then social security will then do the calculation and then allow her to know if which benefit is higher or what it will be her best option. But ultimately online or at the local field office.
Okay, thank you. Here's another question. I'm carrying my federal government insurance into retirement. Will that count as Medicare Part D?
Well, I do not know too much about federal um, insurance, and I honestly don't get many questions about it, which is crazy, especially living here in the DMV area. That I don't get a lot of questions behind it.
Mhm.
If we go to the next question, I'll do some research.
Absolutely. I'm on Medicaid and now 65. What do I do? Can I talk or who can I talk to?
Yeah, if you're on Medicaid, you're what's known as a dual enrollee if you're on both Medicaid and Medicare. And there are specific plans, Medicare Advantage plans that are designed for people who are both on Medicare and Medicaid. And so what I would recommend you doing is talking to your SHIP, your state health insurance assistance program, and that number for the Virginia for VICAP is in the chat already. If not, you can go to shiphelp.org to find that number for Virginia, or if you're in another state, you can find it in that state, or there is a general 877 number that is associated with your ship, and they will help you navigate being a dual enrollee.
Okay. This is another Medicaid question. Where do I get the Medicare packet or will it be sent to me? I will be 65 in January. So I meant Medicare. Sorry about that.
No, you're fine. So you should be getting stuff in the mail around this time with if you are already collecting your Social Security, that's the key part. You have to be collecting your Social Security at this time. If you are not collecting your Social Security, then you will just need to be having to go and enroll through the My Social Security portal that Jamie was talking about earlier. That you can go on there. You can enroll into Medicare if you're not already collecting your Social Security.
Excuse me, one quick minute, Catherine. There were two questions that got placed in the chat. And I think they're important. So, Catherine, I know we're supposed to be in the Q&A, but could you take a peek at those two questions, please?
Okay. The last one.
The first one and the last two. Yes, ma'am.
And also,
So,
the federal plans offer credible drug coverage. So Medicare eligible current employees and retirees enrolled into the federal health plan can delay a Part D enrollment without incurring a late penalty.
okay.
I think it's one from Joe and one from Gwen. Does that
Right.
help? Okay,
Yes.
got it. Sorry about that, Catherine. I
Not
know
a problem. I
but
thought
I
that
didn't
was
want to
one
miss
that
it.
needed to be addressed.
Yes,
Yes.
ma'am. Yeah.
Thank you. My husband was told by his employer not to apply for Medicare since he was not retiring until 67. He is covered under his work PPO. How is this going to impact his Part D and Medicare? I don't think they told him correctly. His 67th birthday is in July, and he retires the first part of June. Do I need to read that again, Jamie?
No,
Oh,
no.
no, that'll be for
Maybe.
Xavier.
Yes. And so the thing when it comes to employer sponsored healthcare and Medicare, there are some rules that are associated with it. So if you work at a small employer, which is defined as 20 or less employees, then you have to enroll into Medicare when you're first at 65. The one caveat to that would be if you are in a group health plan and someone has qualified for a large employer. If you are at a large employer or 20 or more employees, then you have options. You can delay your enrollment completely. You can do a hybrid approach, which is what a lot of people do, because we know that for most people, Part A is free. So they go ahead and enroll into Part A, and then they delay their Part B enrollment. Or you enroll in both your A and B, and you can do other add-ons and stuff later once you retire. But as long as your spouse is at 20 or more, the employer was correct.
Okay. I retired March 31st, 2025, turned 65 in mid-July of this year, received spousal survivor Social Security benefits, and am enrolled in Medicare Part A. I have federal insurance coverage and I carry it into retirement. Question: can I delay signing up for Medicare Part B until December 2025 to start in January 2026? If so, is the Medicare premium based on my 2023 income or 2024?
Okay. So that's two parts. I think we both have a question to answer. So Jamie, I think it starts off with Social Security, right?
It was a
Or
long
that's just a
question.
statement.
Yes, I can repeat. I retired, is that the one? Retired March 31st, 2025, turned 65 in mid-July 2025, received spousal Social Security benefits, and am enrolled in Medicare Part A now.
Yeah, it looks like the question is, can they delay signing up for Medicare Part B
Yeah.
until
Yeah,
December 2025? Right.
until December. Yeah.
Hmm. But
Um,
they,
I'm just making sure I'm reading the question to making sure
yep,
that
a lot of dates. Want to make
yes,
sure you get the math right.
exactly. So it's important to note that for Medicare, when they look at your premium, they do a 2-year look back. And so it will actually be determined based off from 2 years ago and not just your most recent information. So that's part one of the question. Part two of the question is signing up for part B. Since you did not sign up, when you retire, you get an 8th month special enrollment period to sign up to retire once you retire. And so you will still be within your 8 months to if you start your part B in January. With that being said, so you wouldn't face any penalties. With that being said, if for some reason that doesn't happen, January through March is the general enrollment period, and that is for people who did not sign up for Part A and Part B when they were first eligible, either through age or through retirement and losing their coverage. And that is the time you can sign up as well. So you do have a little flexibility in that. So I think I answered both parts of that question.
I did see a statement from Eve in the chat. Eve F said she's afraid of delaying benefits won't be there. I just want to just touch on that part. Now, Social Security still is overall in good financial shape. So when we talk solvency, if Congress doesn't act, then we're speaking 2034 until benefits will be affected. But if we look back to the history of Social Security, um, back in what they did, I believe in 1983, not a historian, but I believe it's 1983, that's when they raised the retirement age. As you saw in the chart earlier in the presentation, that was gradual based off of the year you were born. Also, in addition to raising that retirement age, a little bit after that is what happened is that they raised the wage cap and the taxes on the higher earners. So if history repeats itself and Congress follows history, that might be something similar to that approach. So I wouldn't say it's smart to be somewhat worried about the delaying benefits, but there isn't really any indication that your benefits won't be there. So don't I hope that your strategy wouldn't be claiming early just because of that. Because keep in mind that when you make that decision is for life and for any dependents or anyone else that will claim on your Social Security. And I believe we're coming up on time, so I'll just pass that back to Catherine.
Okay, I think here's one I don't think was addressed. I'm a veteran, so there is a form. Is there a form to complete to have military coverage versus Medicare? This will be the last question. Should I
So
repeat?
there's not a form that you would have to complete, but it's also important to note that if you're like TRICARE for life, then you are supposed to sign up for your Medicare for Part A and Part B. But we also do know that some people who are at the VA, they stay with the VA. They don't want to go anywhere outside of the VA. And so they elect to just keep all their coverage and stuff through them. But if you have TRICARE for life, you're supposed to sign up for Medicare. But there is no form to fill out per se.
Okay, looks like that was the last one. I just want to say thank you all for participating today. We hope you feel encouraged and have a better understanding of Social Security and Medicare. Please complete our survey to let AARP know how much you enjoyed the program. Now, the survey link will be placed in the chat. I think it's there. Please come back and join us for Social Security and financial planning for caregivers on Tuesday, November the 4th at 2 o'clock p.m. Eastern Standard Time. The registration link has been placed in the chat as well. Now, the AARP Social Security link has been placed in the chat too. If you are interested in rewatching this program, please check out our AARP Virginia YouTube page. Again, a big thank you to our guests, Jamie, Xavier, AARP staff, and you. Again, I'm Katherine Jackson, your AARP volunteer host. Thank you for joining us today. This concludes our program. You may now leave the Zoom meeting. Have a great evening.